On the Breast Cancer Awareness Month, how fast do you think cancer of any type or breast cancer can take to get to stage 4, from the beginning to stage 4? Like, I know many of us think it's many days or many months, but or some years, but actually that may not be the truth. So last week or so, I had a conversation with a survivor of breast cancer, and we were just having a conversation, and I was like, what are your life goals right now? And she was like, to keep my cancer with in to keep my cancer controlled for now without many admissions and all that. Then I was like, by the way, what was your initial cancer? She told me, oh yeah, my first cancer was breast cancer. And it hit me like, I didn't expect her to say it was breast cancer. So I was like, oh, I didn't know that. So the next question was like, and she told me, before you ask me the next question, I know the next question will be, were you doing self-breast exams? Because that's what everybody else has been asking me. I was like, yeah, I wanted to ask you that question. She told me yes. But for me, I did self-breast exam every 3 months. And I was diligent with my 3 months because I had family history of breast cancer. But for no reason, I just chose to do it every 3 months instead of doing it every month. But she said, as a younger person, she did it every month. This is a person above 60 years. So as she advanced with age, she minimized the number of breast cancer checks, self-breast exam, and she did them every 3 months because she was also doing, I think, annual mammograms or something like that. So she told me, like, there's this particular, like this, she did, of course, did not palpate anything. Then 3 months later, in the shower doing the breast exam after 3 months, and she palpates a lump that she told me it was this size at first. So she immediately called the doctor and said she needed an appointment. She had a breast lump. She had a family history of breast cancer. I think the mother and 2 sisters have died of breast cancer, and that is usually very, very significant history. If you have a female relative, a mother or a sister, or somebody in that line that has had breast cancer, you may be at risk. So it's always good to keep checking. So she called the doctor and went to the doctor, and they did of course some investigations, and went to theater and got the lump out. So the lump was examined after it was removed, and she was actually in stage 4. Within 3 months, she had developed a lump, and the lump had advanced, and the cancer had spread to her lungs and her bones and to her colon, because she ended up, I think, having a colostomy or an ostomy tube kind of thing. Yeah, she has it still. So, like, it was so fast from not having a lump, like she would not feel anything on her breast, and then the next time she's being told you have stage 4 cancer, started chemotherapy. She's been on chemotherapy, but at least right now the breast cancer is not the main thing. I think she's managing other types of cancers that tend to persist longer. But yeah, that's how fast the cancer developed. So my thing is, like, I know some of us do not like take the breast exam as a very important thing, but as a very key thing in the diagnosis of breast cancer. Let's not be ignorant. Let's do something that will keep us in the line of health. If you have any significant family member with breast cancer, don't be ignorant. Go out and get checked. Keep checking yourself. If you note any abnormalities, don't be afraid to go and confirm what kind of abnormalities is there. As I said earlier in a video I did this month, any breast lump doesn't always have to be cancerous. There are so many types of breast lumps. We have hormonal lumps, and so yeah, we have the hormonal. Most of the hormonals are non-malignant. Then we have the non-hormonals, which could be malignant or not malignant. So it is always good to go and confirm what kind of lump you have on your breast. Once upon a time, I palpated a woman at the clinic. When I got that job, I thought everybody does routine breast exam for all the women. So I did my regular breast exam and I found a woman who had a lump this size. And I sent her to the next hospital to go for an ultrasound. And then after the ultrasound, because we think then we didn't have an ultrasound in the facility I worked, she disappeared. I never saw her before. She was like, oh, I don't want to hear the things you're telling me. I know you want to scare me and tell me I have cancer. Then she disappeared. I don't know what her fate was, but that was not my aim. My aim was, you have a lump, is it okay if we get to identify what is the composition of this lump so that we get to know the way forward? So tusikue watu waoga. Let's not be afraid of knowing the truth about our health. Let's face it so that we live a happy and a successful future, healthy future, take care of our family and our generation or otherwise. Have a lovely day. God bless you, keep you, and sustain you. Till next time. Ciao.